Yesterday, Mayo Clinic Health System in Fairmont announced its surgical and labor and delivery units will cease operations in March of 2025.
The announcement rocked the community, and some are upset at the decision. Kendall Larson tells us more.
Mayo Clinic Health System made the decision to close 2 departments come March 2025 at their Fairmont clinic: surgery and labor and delivery. The announcement has struck a blow to the community, but doesn't come as a complete surprise to some.
We've had a lot of people that even in the last 10 years, people as they get older who need services, they've moved either to Mankato or the cities. They moved out of town because they couldn't rely on consistent services here.
MCHS acquired the clinic back in 2001. Before then, it was a community hospital.
Bought a community hospital that people had put a lot of blood, sweat, tears, and cash into building up this hospital to be what it was. And now it's just, it's just going away.
Mayo said the reason for the reduced services is because the clinic is struggling to find physicians.
Everyone's got the same issue about getting employees nowadays, but they're getting it done.
But now patients are left to drive to another clinic, which could be over an hour away, or change providers.
Not knowing what the next step was going to be, it was terrifying. We definitely had a lot of conversations as to what we want out of a doctor.
Nikki Johnson found what she wanted at United Hospital District.
Dr. Sue, she was everything and beyond. The transition was seamless. She, like I said before, she was kind, compassionate, caring, everything that you would want in a doctor.
UHD saw the gaps that Mayo was leaving and filled them in.
Decided to make the switch from Mayo to UHD because it made sense to be more local. Blue Earth is much closer to Fairmont than Mankato is.
So while Mayo announcing these department closures is a blow to the community healthcare access, other clinics in the area are filling in where they can. In Fairmont, Kendall Larson, KUIC News Now.
Mayo Clinic Health System staff will support patients in transitioning their care as needed. Outpatient surgical and procedural consultations, prenatal, postnatal, and gynecological care, along with outpatient pediatric care, will continue in Fairmont, along with all other existing Fairmont-based services.